Hello, I will be speaking today about the coronavirus pandemic of 2020, lessons for the United States healthcare system. My name is Dr. Anthony Zaharik, and I am a plastic surgeon at Covenant Healthcare in Saginaw, Michigan. I'm also a clinical assistant professor at the Central Michigan University College of Medicine. My talk today will have an introduction followed by 5 lessons for the U.S. healthcare system from the pandemic. While I realize there are many important lessons from the pandemic, I am choosing to focus on what I feel are 5 important lessons that deserve attention. I will then have a conclusion section and then ideas for further study. As an introduction, coronavirus disease 2019 or COVID-19 is caused by severe acute respiratory syndrome coronavirus 2, also known as SARS-CoV-2, and it was first reported in December 2019. The coronavirus pandemic of 2020 represents an entirely new virus previously unknown to humans. The disease can become severe and result in hospitalization, respiratory failure, or death. What lessons has the 2020 pandemic taught the U.S. healthcare system? The pandemic has exposed strengths and weaknesses of the U.S. healthcare system. Ongoing conversation among all stakeholders will be needed for the lessons from the 2020 pandemic to be reinforced. Lesson 1 is the need to understand the pandemic based on science and data. At the early stages of the outbreak, when not much was known about the virus or how it could spread or harm people, there were different responses in the U.S. and elsewhere around the world. For example, in Vietnam, all flights were halted between Vietnam and China. Similar steps were taken in the United States. In the United States, there is also a decentralized public health system, including the FDA, the CDC, the NIH, and the U.S. Health Department. It is the job of all these agencies to inform the public about the virus, and this was done. There was a 15 days to slow the spread guideline in the U.S. that was sent to all households in March 2020. Knowledge of the virus can also have several benefits, where a survey in China was done that shows more knowledge about the virus leads to more happiness. I have put together a chart that shows the cases, deaths, and mortality rates from COVID-19 up till May 3rd, 2021. In the United States, there is a mortality rate approximately 1.8% with 574,000 deaths. In the state of Michigan, where I live, the mortality rate is 2%. In Saginaw County, Michigan, where I work, the mortality rate is 2.8%. Lesson 2 for the healthcare system in the U.S. is there is a need for scarce resource allocation guidelines. There was a close call regarding ventilators in the U.S. where there was a concern that we would not have enough ventilators to treat all patients who needed a ventilator. While this scenario may have been avoided in the U.S., it does show the need to having a resource allocation guideline before scarce resources actually do occur. There are several options for scarce resource allocation, including the multi-principle allocation framework of Dr. Doug White, which includes a triage team that assesses the patient for their need for a ventilator, a clinical team that daily reassesses need for ventilation, and then a conversation between the triage team and the clinical team to determine ongoing need. Covenant Healthcare in Saginaw, Michigan has a similar guideline where they also have exclusion criteria if patients have irreversible hypotension, low blood pressure, or recurrent cardiac arrest. Those are patients that would not be considered candidates for ventilation. Fortunately, these guidelines were not needed in the United States, but again, it's important to have them available before they may be needed. And there were scarce resource challenges in Italy where ventilators were not available for everybody and difficult choices had to be made. There are also scarce resource allocation regarding personal protective equipment or PPE, and also ventilators, again, were becoming a scarce resource. To help meet this demand for resources, there were many community donations of PPE, for example, to Covenant Healthcare and to other hospitals across the United States. Also, the Defense Production Act was used to mandate certain companies such as Ford Motor Company and GM that they produce more ventilators to meet the demand. I have a chart that shows the donations of PPE to Covenant Healthcare, showing gloves were the greatest number of donations, followed by N95 masks. Lesson 3 is the need for effective treatments. This shows a role for disruptive innovation and medical advances. For example, digital connectivity to improve lives. Also, there have been alternate approaches to vaccine development, such as the pandemic paradigm for vaccine development suggested by a group in Europe, where they suggested developing a pandemic vaccine in parallel with multiple steps being undertaken simultaneously, which may increase financial risk, but the rewards could be great to have a vaccine more readily available. Also, collaboration between biotech and federal government is important when developing effective treatments. There's also the potential for treatments other than a vaccine, including plasma from the blood of recovered patients, as well as currently available medications that are used for other purposes. Lesson 4 is policy can help to mitigate the problem. We have a lot of policy in the United States regarding healthcare emergencies, and the trick is to be aware of them and use them effectively. One such policy is the Pandemic and All Hazards Preparedness Act, which is called PAHPA, P-A-H-P-A. This provides guidance during health emergencies, and it enhances medical surge capacity, encourages health professional volunteers, and encourages partnerships for state and regional hospitals. There is also the American College of Healthcare Executives policy statement on healthcare executives' role in emergency preparedness, which also encourages emergency operation plan and a resource allocation plan that is ready to use. There is the Emergency Use Authorization, or the EUA system in the United States, which is utilized by the FDA to allow treatments to progress more quickly without all the red tape. Lesson 5 is that collaboration is needed at all levels of healthcare and government. There is the Health Ecosystem Leadership Model, or the HELM model, suggested by Duberman and Sachs from their book in 2019 called From Competition to Collaboration. This HELM model has 4 components, which includes envisioning the future, align stakeholders, manage boundaries and obstacles, and act and learn. Collaboration did exist in the U.S. during the pandemic and continues to, and there was a good example in New York City between Northwell Health, which is a healthcare system, and New York City churches, which collaborated to provide testing to portions of populations which are most vulnerable to the virus. There was a tragedy at Elmhurst Hospital Center in New York City where patients who had died were placed in refrigerated trucks because they did not have enough room at the hospital to hold those patients. And this is an example of how hospitals are still accustomed to operating as competitors and not as collaborators. There were hospitals near to Elmhurst Hospital Center that did have room and beds for those patients. They just did not accept those patients or reach out to accommodate them. In conclusion, there are 5 important lessons from the pandemic for the U.S. healthcare system, including the need to understand the pandemic based on science and data, the need for scarce resource allocation guidelines, the need for effective treatments. Policy can help mitigate the problems, and collaboration is needed at all levels of healthcare and government. The challenge for the U.S. healthcare system is to learn from these lessons and to engage all stakeholders to discuss reasonable solutions. It is also useful to place the current pandemic in context with other recent pandemics over the last 100 years. I have a table that shows the death rate approximately of 2% from COVID-19 compared to influenza 1918, 10% death rate. H1N1 2009, 0.03% death rate. HIV and Ebola have death rates of 40% approximately. That helps to place this current pandemic in context. Ideas for further study include a role for telemedicine during this pandemic and how it can connect vulnerable patients to their providers. Also, methods to improve the supply chain for U.S. health systems. There's also the need to monitor nursing homes to prevent the spread of the virus. Also, what can be done to mitigate the effects of daycare centers that are closed and how that affects the ability of healthcare workers to get to work. There's also the importance of well-being of the healthcare workforce. Financial pressures that the pandemic has placed on hospitals across the U.S. deserves further study. And there is also differences in the death rate among different races. For example, the death rate from COVID-19 is higher in African Americans than other races. All these ideas for further studies will ultimately provide even more lessons for the U.S. healthcare system from this pandemic. Thank you very much for your attention.